this time, I'd like to introduce you to our speaker, Claudia Wade. Claudia is the Community Development Manager and Grant Writer for Union General Hospital in Farmerville, Louisiana. Prior to joining Union General Hospital, Claudia worked 16 years with the Peace Corps, helping the agency to develop community programs to better the lives of people in rural communities. She also worked for the Agency for International Development with the Central American Peace Scholarship Program. One of the programs Claudia manages for Union General Hospital is It's a Girl Thing, Making Proud Choices, an STD HIV pregnancy prevention program for girls grades 6 through 12. Claudia has a degree in marketing and business. Her experience includes price and cost analysis, project management, financial management, and she is fluent in English and Spanish. A resident of Farmerville, she has actively volunteered in her church and various social services and community agencies with law and youth programs in North Louisiana. Now I'll turn it over to Claudia.
Hi, everyone. Can everybody hear me well? Well, my name is Claudia Way again, and I'm the Community Development Manager and Grant Writer for Union General Hospital, Louisiana. I am also the Program Coordinator for It's a Girl Thing, Making Proud Choices, which is an STD, HIV, and pregnancy prevention program created for Union Parish by Union General Hospital. It is an honor for me to present and share It's a Girl Thing, Making Proud Choices with all of you. How to create a program like this and the importance and the impact a program like It's a Girl Thing can have in improving population health. Union General Hospital is a 501c3, 20-bed, critical access hospital. It serves Union Parish, Louisiana. The hospital is located in the county seat of Farmerville. We are a very small community in North Louisiana, and as of the 2010 census, the population of Union Parish was 22,721 and 3,860 in Farmerville. The hospital employs 148 people, and it provides acute inpatient and skilled nursing facility beds, 24/7 ER physicians on site, physical, occupational, and speech therapy, outpatient mental health, ultrasound radiology and CT scan, full-service laboratory, endoscopy, mammography, telemedicine, and operates the rural health clinic. The mission of Union General Hospital is providing quality service with compassionate care, and our vision is to be the facility of choice for patients, physicians, and healthcare professionals for the delivery of high-quality and cost-effective clinical health care services. We are aware that executive leadership involvement is critical in developing a successful community health program. Without the engagement and commitment of Union General Hospital CEO Evelyn Ormond, It's a Girl Thing, Making Proud Choices will have never been possible. Evelyn believes that focus on population health is a necessary strategy in the current market to guarantee success in the future. With Evelyn's support, we were able to put the funding together and the human capital to implement the program. It's a Girl Thing is an in-depth, multi-phase program which requires a diverse leadership team with expertise in management, clinical care, and mental health training. Having the right team is the most important part for the creation of a program like It's a Girl Thing. The members of our team are myself, Claudia Wade. I am the program coordinator and also responsible for the curriculum of the program, the implementation, promotion, management, supervision, and evaluation of all the activities of the program in accordance with the strategic plan. I serve as the project lead and primary point of communication for external audiences, including regular communication with and convening of community partners and other community leaders in Union Parish. I am also bilingual in English and Spanish. Jaime Brown, with a Bachelor of Science in Psychology, and Sherry Banks, board-certified mental health and psychiatrist nurse, are the group facilitators and educators. They speak to the girls about topics of health, wellness, and life skills related to teen pregnancy prevention. They facilitate the educational sessions according to the fidelity required by the curriculum of the program, based on emphasizing sexual literacy, poverty, decision-making, body image, abstinence, and roles and relationships for the participants and their families, ensuring all participating teenagers experience personal growth, have improved self-esteem, and increased knowledge about and planned pregnancy prevention. This is our team from left to right: Evelyn Norman, our CEO; Sherry Banks, board-certified mental health and psychiatric nurse; Jaime Brown, with a Bachelor of Science in Psychology; and Claudia Wade, program coordinator. Union General Hospital developed and implementing It's a Girl Thing, Making Proud Choices in 2013. We fund completely the program and also manage the program. The program is supported by community organizations and local volunteers. We collaborate with the school district and faith-based community. The hospital conducted a community health needs assessment in 2011, supported through the Rural Hospital Performance Improvement Project. The hospital also conducted another community health needs assessment in 2015 in order to meet the Internal Revenue Services guidelines. The Community Health Needs Assessment Hospital Steering Committee identified the top health need priorities in our community, which are sexually transmitted diseases, teen pregnancy prevention, and early education in schools. In 2012, the team of It's a Girl Thing came together with its experience and backgrounds to offer It's a Girl Thing, Making Proud Choices to the community of Union Parish. The program began in the fall of 2013. In less than a year, over 200 girls were enrolled in the program, and monthly meetings were being conducted at the hospital and biweekly meetings at the high school. The team meets with the girls once a month at the hospital, every week at the junior high school, and every other week at the high school. We also offer the program to the youth groups from churches around the area, and we are also reaching out to girls outside the parish. The churches from Union Parish and Lincoln Parish bring the girls in their church vans to the monthly meetings at Union General Hospital. The Union Parish teen birth data 2009 and to 2011 was 61.9 per thousand female population, ages 15 to 19. The same report period, 2009 to 2011, teen birth rates in the parish were higher than the Louisiana rate, with the Hispanic rate significantly higher than the other population groups. While sexually transmitted diseases can affect individuals of all ages, youth age 15 to 24 account for half of the 20 million new STD infections in the U.S. each year. Chlamydia, gonorrhea, and syphilis are the most commonly reported sexually transmitted diseases in the country. Louisiana reported some of the highest STD rates in the country in 2009. In 2014, which is the last report available in the Louisiana Department of Health Office of Public Health STD HIV program online, Louisiana ranked first in the nation for congenital syphilis, second for primary and secondary syphilis, third for chlamydia, and first for gonorrhea. It's a Girl Thing mission and goals. Our mission is to help change the views, circumstances, and lives of teen girls. our goal is to connect and educate with teen girls 6th to 12th grade with a focus on pregnancy and STD prevention, while utilizing educational activities, health information, and comparable testimonials from influential community leaders. We provide information to teen girls for use of tools to guide a process of understanding the importance of self-worth and setting goals in life. Our purpose: reduce sexually transmitted diseases and prevent teen pregnancy. Increase early education in schools about this matter. These were among the priorities identified by the Community Health Needs Assessment Hospital Steering Committee in 2012. It's a girl thing objective. Our main objective is provide education to increase knowledge based on local teams. Education changes a person's lifestyle and changes the future generations, enhance decision-making skills, and change attitudes and beliefs about self-worth. Our goal when we first started the program is to be an example of population health management. The program supports population health concepts, improve the health of teen girls, improve the girls' experience of care, reducing sexually transmitted diseases and preventing teen pregnancy, using smart data collection to continuously adapt the program as the participants' individual needs change. The program is contributing to breaking the cycle of poverty by helping teen girls set goals and address self-esteem issues. Increasing early education in schools, just as schools are critical settings for preparing students academically, they are also vital partners in helping young people take responsibility for their own health. Education transforms girls' lives and entire societies. We are reducing the per capita cost of care for teen girls in Union Parish and the surrounding areas with our program, providing knowledge, enhancing decision-making skills, and changing attitudes and beliefs about self-worth. To maximize the success of population health programs, we cannot operate in isolation, and we are aware of that. To increase the number of people engaged in It's a Girl Thing program requires the collaboration with organizations and individuals who work outside the walls of the hospital that provide services impacting community health. With the program, we are implementing patient-centered interventions, teen girls. In order to make It's a Girl Thing a successful population health program, we focus on specific outcomes and then develop processes to achieve those outcomes. These are the program targets. Self-esteem, which is to us, has become the priority in the program, and mental health. If your mind is healthy, your body will be healthy too, and we strongly believe that. Dating and dating violence. We are teaching the girls how to deal with bad situations, how to respond in a way where they can protect themselves mentally and physically, how to detect a bad behavior toward them from boys. We are teaching them also about their reproductive system, sexual health, And of course, teen pregnancy, sexually transmitted disease. We reinforce these classes not only once, but every single time we can, every single time we teach. We talk about teen pregnancy and sexually transmitted diseases, sexual abuse, nutrition, drugs, tobacco and alcohol, bullying, and suicide. In less than a year, since when we first started the program, over 200 girls were enrolled in the program, and monthly meetings were being conducted at the hospital and biweekly meetings at the high school. It's a girl thing development. How did we start it? Community Health Steering Committee decided to focus on teen pregnancy and STDs at the end of the survey. The program team was created by recruiting community leaders who had a passion for the issue. We bring guest speakers and faith-based community. Every month we invite somebody from our own community that the girls can look up to speak about all kinds of topics, and also to bring their testimony and share with the girls. The team, before we started the program, we researched programs addressing the issue across the country, such as Girl Talk or Making Proud Choices, which is a very successful federal program. And this way, we put our own program together, and we adapted the program according to the community needs. And as the program goes along, we change it depending on or as per request of the community or the girls. It's a girl partnership. The first program was created with the intention to provide teen meetings twice a year. The program was presented to school superintendent, who was so impressed. He asked us to provide biweekly meetings, and as an alternative with physical education, the girls have the option to attend our class or stay in physical education. Most of the time, they want to attend our class. We have reached the point that we have a personal relation. The girls are not afraid to ask questions or call us or ask for help. And we refer them, or we try to put them in touch with the right person or take them to see medical provider. Without the community support, it's impossible to have a program like It's a Girl Thing. So after thinking about twice a year, we evaluated and our program goals, and we decided that twice a year will not be enough. And additionally, we hosted a Union General Hospital monthly meeting, and as I said before, including guest speakers, handouts, and snacks for the girls. As community members saw the benefits, local businesses began donating items such as lotions, personal hygiene, and hair products, makeup, and educational CDs, all geared towards making better life choices and enhancing self-esteem. It's a Girl Thing in 2014. In 2014, It's a Girl Thing, Making Proud Choices, a scholarship award program was created to offer $1,000 scholarship to a female senior attending a high school in Union Parish. So far, we have given 3 scholarships. Then, that same year, we began addressing mental health issues and suicide risk, and now evaluate and refer each girl for these issues. We have been able to save 4 girls from committing suicide. They keep coming to the meetings, and they are doing very well. A program addressing drug, alcohol, and tobacco prevention was added that same year. So we try to reinforce that part, and we invite local organizations with programs for drug and alcohol prevention to come and talk to the girls about these issues, and also get speakers to tell about their experiences with alcohol and drugs and tobacco. It's a girl thing for boys. Local ministers requested Union General Hospital work with boys in the community. But girls want to listen from girls, and boys really want to listen from boys. We try to put a program together, and we realized that boys need boys to talk to them. So we decided to, with Union General Hospital funding, we brought an expert in an evidence-based program to provide training to work with teen boys. And 10 community leaders were trained, and among them, 6 were male from a faith-based community. And they are working on putting a program for boys together, and I hope they will succeed, and Union General Hospital is supporting them as much as we can. In 2016, in collaboration with the school district and under the 21st Century Grant, we began offering the program weekly to 6th and 7th grade girls. We realized that if we start educating the girls, the younger we start, the better the results will be in a long period of time, and the results will be a lot greater if we do this. And we have been very successful. We don't have less than 14 girls in each class every week, and they are loving the program. We have to create a different curriculum for them in order to adapt the classes to their age. But we realize that the questions are the same, and they need to be educated in that area in order for them to have a better response with the situations they are encountering in life. Program outputs. The girls are safely being able to explore the consequences of their sexual health choices, identify how teen sexual health choices affect them for the rest of their lives, and analyze how sexual health choices affect the aspects of their overall health, to include physical, mental, emotional, social, and spiritual health. They are being empowered by knowledge to make healthy choices. Our stats. We have been running the program for 3 years, 2013, 2016. In those 3 years, over 3,000 girls have been served through the program. Over 200 girls are attending our meetings at Union General Hospital and local schools every month. monthly, counting all the girls that come to the meeting every month, every other week, and every week. We have over 900 followers on Facebook and Instagram. Please like us on Facebook and Instagram. Over 109 meetings have been held at Union General Hospital, Union Parish Junior High School, and the high school. This is our scholarship recipient from last year. From left to right, myself, Mykaila is in the center, and then Jaime Brown, our Bachelor of Science in Psychology. Mykaila Alexander graduated Valedictorian in 2016. That same year, she was offered a summer job in Union General Hospital. And as part of the program, Union General Hospital wants to give the professional experience to a talented young girl that is enrolled in the program every year. So we're implementing this practice as part of it, the girl saying making proud choices too. The attendance is always like this, and sometimes we don't even have a place to put another chair, which is a blessing. So every month we are very, very excited about seeing all these girls walking through the doors of Union General Hospital, wanting to learn a little bit more, and all the community supporters usually sit on the back to listen to the presentations and wait for the girls to take them back home. And that includes Union Parish, Lincoln Parish, and anybody in the surrounding areas that is more than welcome to attend our meetings. Successful women serve as role models for the team. We invite successful women from our own community, women that they've known since they were born, to speak to them this way they can relate better to situations and learn from their experiences. Besides our team, like I said before, we have a lot of volunteers, not only outside of the hospital, but inside of the hospital. A lot of our employees donate their time to this program after work. This is our outcome in a period of 3 years. We have increased the graduation rate. When we first started the program, from all the girls in the program, 24 graduated. We referred 4. We had 4 medical referrals, and 3 of them got pregnant. The second year, 38 graduated. We had 5 medical referrals, and 2 got pregnant. The third year, 2016, 43 graduated, 6 medical referrals, and 2 got pregnant. Things have changed drastically. When we first started the program, we used to see a lot of girls walking pregnant around the high school. Not anymore. I can probably say that there are 1 or 2, and now they are not like very open about their pregnancies, but they are more like they don't feel that pride of being pregnant like they used to 3 years ago. Now it's more like I should have done something, I should have come to the class, I should have learned something to prevent this situation. So we are bringing awareness with the program, and that's one of our success. What have we done with teen birth decrees? The teen birth rates decreased 2013-2016. The goal of It's a Girl Thing, when we first started the program in 2013, was to decrease teen pregnancies by 5% in a period of 5 years. With our program, we have decreased teen pregnancies by 18% in Union Parish in a period of 3 years. When I saw the report, I was ecstatic. I was just happy about it, and the reassurance that we are doing something great for our community. The state teen pregnancy decrease was 8% in the same period. We're going to continue with what we're doing until we can drop the teen birth even more. We don't have much information about the STDs because there is the last report was from 2013, which was the year that we started the program. So I hope that if I have the opportunity to present in another time, I have some statistics and I will have some more information about that. But I'm hoping that if the teen birth decrease in teenagers, also the STDs and HIV will decrease. I'm sorry. Here we are. Recognitions and awards. In 2014, we received an award as an Outstanding Rural Health Program of the Year from the Louisiana Rural Health Association. In 2015, we received an award from the Hospital Charitable Service Award of the Program of Promise from the Jackson Healthcare Foundation. Only 4 in the nation won this prestigious award out of a pool of over 200 nominees. This was an honor for us. And the Program of Promise Award is given to programs that have just started, and we didn't have at that time any statistics to prove how successful the program was because it was just the beginning. But they give the award to programs with future. So they saw future in our program at that time, and that's how we got Program of Promise. In 2016, we received Program of Excellence Award from the Hospital Charitable Services Awards, Jackson Healthcare Foundation. In 2016, we were able to prove that we had success with the program. We were able to present the statistics, and this award is given to 10 prestigious programs in the nation out of over 200 nominees nationwide, and we are very proud that we received this award. They will be coming in April the 13th to present this award to us here at Union General Hospital. So if anyone can come, it's more than welcome to come join us. It's going to be at our conference room at 1 o'clock in the afternoon. We were also recognized by the National Rural Health Resource Center, Small Rural Hospital Transition Project Newsletter. Thank you very much, Rhonda and Kim and everybody else, for this award. And we were recognized in May 2014 and again in October and November of 2016. Our next steps. Well, we will continue to maintain and increase participation. We are offering program participation to other Louisiana parishes. And we are thinking about creating a mentor program utilizing past participants as mentors, which is working very good, but we want to be able to improve it. And also utilize technology to include women from other countries as speakers to help girls broaden their views. And I had this idea because I met a lot of girls in 16 years with the Peace Corps. I met a lot of girls with a lot of experiences and point of views to our life, which are professionals working all over the world. And and then they are willing to share their experience, their personal experience, and also their life experience, professional experience with our girls. In this way, we can put meetings together, and they can be live and sharing with them. So this is a work in progress, and we hope we can do it soon. But I'm hoping also that if the teen birth decrease in teenagers, also the STD and HIV will decrease too. And I want to share a little bit about the impact our program is making in these girls. And I wanted to share with you Mykaila Alexander's personal experience. Mykaila, as I said before, was valedictorian school year 2015-2016. And she was also the recipient of It's a Girl Thing, Making Proud Choices, the scholarship 2015-2016. And I would love to read her testimony to you. And it said, ever since I was younger, I have dealt with being bullied and terrorized by the other kids due to my race, size, glasses, and differences. Although I knew I should have told my parents at the time, I was scared that their intervention will only make the situation worse, or that the teachers wouldn't believe me due to racial differences. Throughout those miserable days in elementary school and middle school, all I wanted was just one person I could tell what was going on, but that person is someone I could never find. It was not until I got into high school that I finally found someone I could talk to and trust, look up to, and depend on for. So I met the women over It's a Girl Thing, Making Proud Choices program have helped me so much, teaching me how to be myself, how to embrace my differences, how to be who I am, how to know my self-worth, and how to not settle for less than the best. It's because of this knowledge that I am the confident and intelligent young lady I am today. Words cannot explain how much It's a Girl Thing has changed my life. It's amazing. Those kind of stories really touch our heart, and every year we have a meeting where each one of them write how the program has changed their lives and has impacted their future, and sometimes the result is just amazing because they come sit at our meetings, but it's not until they tell us that we know what we have done. I want to invite everybody to go to the Center's Hospital Spotlight webpage to learn more about Union General Hospital and its a Girl Thing program. We have different links and the spotlights and the articles written by in August 2013 and the hospital spotlight. So please, if you need more information, you just can click on it to learn a little bit more about the program. And if you have any questions or if you need to get in touch with me, here's my information, my email address, my telephone number, our website link, and please visit our Facebook page. It's a Girl Thing, Making Proud Choices on Facebook. Thank you very much, and I'm now open to any questions.
Wow, thank you so much for presenting that, Claudia. Oh, does someone have a question? You can type your question into the chat box, or you can press *2 to unmute your phone line. Claudia, there was one question. What types of things about your community did you consider when creating the program?
Well, first, among all religious beliefs. We have to take that, and it's a big, big consideration because it's kind of hard to teach sex without talking about sex. And we really need to talk about sex. So we need to find the right way to approach the subject. And also to get everybody on board. Talk to the pastors, talk to the preachers, and then come up with a plan. And one thing that we always do is that every year when we have new girls, we invite the parents to come to the first meeting, and where they know what we'll be talking about and present the curriculum to them, and they also sign a release form for the girls, plus the registration form. But that was the main key. In order to have a successful program, we had to take in big consideration the beliefs and the way the community thinks. Did that answer the question?
I think so. Thank you, Claudia. Rhonda from Rural Health Innovations here, she says she was lucky enough to be there during the CHNA, and she remembers the people in the community believing this issue could not be changed because the behavior was so generational. How did you overcome this attitude?
I'm sorry that our speaker went on. Could you please repeat that?
Oh, sure. Yes, Rhonda, she was lucky enough to be there during the CHNA process, and she remembers the people in the community. They believed that this issue could not be changed because the behavior was so generational. How did you overcome that attitude?
We are very honest. And, we are having a phenomenon right now because I know it is a generational problem, but we have the parents supporting even because they want to break that pattern. So we came back and we include in our classes some strategies. And we tell the girls, it doesn't have to be this way generation to generation to generation. Somebody's got to break that pattern. And having 18% decrease in pregnancies in 3 years when we were expecting just 5, it tells us that we are doing the right thing. And I remember that. And I remember that everybody was saying, how are we going to change this if this is just a generational pattern? But it seems like the girls are understanding that they can break that. They can break that pattern and do something different. And I could read it in a testimonial from another girl that said that even her mother used to put her down and tell her that she was worthless. And, well, she graduated some of the top of her class. She's going to college now. She's going to Grambling University, and she's doing really well. So self-esteem and self-worth play a key role in a program like this. We're teaching the girls like they worth a lot, and their self-esteem is changing. So they want a different life, even if the previous generations lived in a different way.
Absolutely. I think one thing that stood out for me from Mykaila's valedictorian letter was that she just needed someone to listen to, and your program was there for her, which is really, really amazing.
Yes.
Claudia, could other rural hospitals adopt or replicate this program in their communities? What advice would you provide to other hospitals that are interested in developing a program such as It's a Girl Thing in their community?
Absolutely. I mean, they can absolutely do it. But the first thing is to take in consideration what the community thinking is, what the community needs. And I'm sure we all need a program like this. And while programs may differ, what people get doesn't are the critical core components of a successful population health program. So the same topics can be used, but the team's got to have the right people and more or less the right set of minds. And the best advice I can give is honesty. We have to be honest and just don't go around the subject. Just be straightforward what we are teaching, and that's the way we do it. If the teenagers are very, very smart. They don't want to be treated like children, the small children, especially the girls. So if they ask a question, let's be straightforward, not because they're going to feel bad or they're going to feel good. No, it's just to be honest. And this way, any program put in place will succeed.
Call the operator.
So, combined with the effective team engagement component, this should serve as the basis for launching any program like It's a Girl Thing, Making Proud Choices, and be sustainable.
Great. Thank you so much, Claudia. Kyle Cameron says, this is inspiring and necessary, and I don't think there's anyone on this call that doesn't agree with that. Are there any other questions for Claudia today? Or Claudia, is there anything else that you'd like to say?
Well, we need to make sure there are, some foundational components for a program like this. And the hospital was aware of that, and we have been engaging ourselves in a lot of population health education, and so we need to take all this in account. And in a parish like ours and most of the parishes in Louisiana, if you don't offer the program free of charge, the girls are not going to come. And let's be honest with it, and that's part of it. That's part of our mission at the hospital too. Provide the quality service the community needs. So it is very important to take all these components in order to put a program like It's a Girl Thing, Making Proud Choices together. Because we have to provide, when a target population is provided options on how to participate in a program, and those options cater specifically to their needs, it is more likely to the program to achieve short and long-term success. And it's been proven with It's a Girl Thing, Making Proud Choices. That would be my best advice.
That's great. Great advice, Claudia.
Thank
Jill
you.
says, you said the girls had a choice of attending this program instead of PE. How did you work that out with the schools?
Well, Dr. Cannon, the school superintendent, they couldn't open a new slot just for the class, just for our class. So they said, okay, we need this in our schools. So this is what we can do. We're going to give the girls that goes to the PE class the option to stay in the class and be in PE, or to go to your class. That's the way we're making it work with the school. They couldn't provide us an hour for It's a Girl Thing, but they gave the girls the option to go to our class or stay in PE. So having the option, they like that. The girls like that because they are not being forced to attend our class. But they love to come, which is a bless. So every time we go to the school, it's kind of funny. It's like a mama going to get the girls in the gym, and they walk behind us, 15, 30 girls, 15 so at a time. Then we stay at the school 3 hours every other week, so we have no less than 30 girls all put together. And the same thing with the partnership we have and the classes we offer at the junior high school under the 21st Century Grant. They include It's a Girl Thing, Making Proud Choices in their curriculum as part of the after-school program, which is funded by the 21st Century Grant.